Welcome my colleagues and my dear students. Today we are speaking about the cardiac conductivity. As we said in the previous lectures, we have four main cardiac properties. First, rhythmicity, second, conductivity, third, excitability, fourth, contractility. Rhythmicity is the ability of the cardiac muscle to generate nerve impulse. Conductivity is the ability to transmit it to every part of the endocardium. Excitability is the response of the cardiac muscle by generation of action potential inside the muscle itself. And finally, contractility is the process of converting the chemical energy of food into mechanical energy, which is in the form of pumping function of blood. So what is conductivity? Conductivity is the ability to conduct the nerve impulse from one side to another inside the heart. Inside the heart, we have no nerves. We have modified cardiac muscle fibers that work like nerves and conduct impulses by velocities that are similar to that present in many nerves. First, we have here the SE node, and here we have the AV node. In between both, we have what is called internodal pathways, anterior, middle, and posterior internodal pathways. These pathways conduct impulse from SE node to AV node. We have also what is called interatrial band, which conduct impulses from the right atrium to left atrium. We have also the AV bundle, which transmits impulses from the atria to ventricle. Later, AV bundle divides into right and left branches, which descend on both sides of the interventricular septum to reach the apex of the heart, where they become reflected towards the base of the heart and giving many branches which are called the Purkinje fiber. This system is called conducting system of the heart, and it is responsible for fast spread of impulse within the myocardium. We have different velocities of transmission within the conducting system. Regarding the internodal pathways, we find that the speed is about 1 meter per second. In the AV node, it is very low, 0.05. It is about 1 to 20 the velocity in the internodal pathways. In the Purkinje system, we find it is very fast. The speed in the Purkinje system is about 100 times the speed in the AV node. Finally, in the contractile fiber, the speed is 0.5, which is 10 times the speed in the AV node, but it is much less than the speed in the Purkinje system. So there is a great variability in the velocity of transmission in the different parts of the conducting system. This because the velocity of transmission is dependent on many variables. The speed of transmission is directly proportional to the size, to the amplitude of the resting membrane potential, to the number of gap junctions, to the speed of depolarization. To study the process of conductivity, we have to divide it into four steps. First, conduction of impulse through the atria. Second, conduction of impulse through the AV node. Third, conduction through the Purkinje system, which is a part of the conducting system that is present inside the ventricles. Then finally, the spread of the impulse in the ventricle itself. First, regarding the impulse transmission in the atria. The impulse starts here in the SE node, and it has three main directions. First, towards the AV node via the internodal pathways, anterior, middle, and posterior, by a velocity of 1 meter per second. Second, it passes from the right atrium towards the left atrium via the interatrial band by a velocity that is similar to the internodal pathways. The third probability from the SE node towards the contractile fibers of the atrium, and this occurs through the gap junction. Within the atrium, it passes by a velocity of 0.5 because it is a fact that the velocity of transmission of impulses through cardiac muscle fiber is 0.5 meter per second. Impulse transmission through AV node As we said before, the velocity of transmission inside the EV node is the slowest, and this is because it has less gap junctions, the fibers are less striated, the fibers are of small size, and its depolarization occurs slowly, so the velocity of transmission is the slowest, which is 0.05 meter per second. This provides what is called EV nodal delay, so the impulse needs about 0.09 second to cross the EV node. This area, the EV node, is the area of the lowest velocity of transmission in the heart, and it gives us what is called EV nodal delay. EV nodal delay, as I said, because of the smaller size of the fiber, the more number of gap junction, and the less negative resting membrane potential. The EV nodal delay is physiologically significant. This delay provides time by which atria can emit the blood inside the ventricle. If this time is not present, atria have no time to transmit their blood to the ventricle. Second is a clinical significance. We have a famous clinical condition that is called the atrial fibrillation. In this condition, our heart abnormally beats by about 60-100 beats per minute. This logically causes loss of the pumping function of the atria. However, the pumping function of the atria is not essential for life, because most of blood pass from the atria to the ventricle by pressure difference, not by the pumping power. However, if this high rate crossed totally to the ventricle, this causes immediate death. In fact, this does not occur because of EV nodal delay. So only 1/4 or 1/3 of these impulses can pass to the ventricles, and these persons can live many decades. Third, conduction through the Purkinje system. The Purkinje system starts just after the EV node. We have two parts of the Purkinje system regarding the velocity. The initial part, which is called the penetrating portion, has a velocity that is similar to the EV node, which is very slow. The remaining portion of the EV bundle and the Purkinje system has the highest velocity in the cardiac muscle, which is 5 meters per second, allowing very fast transmission of impulses towards the endocardium. So it needs only 0.03 seconds to cover the entire endocardium. The very high velocity of the Purkinje system is due to its large sized fiber, its rich gap junction, and more negative resting membrane potential, as I said before. After that, the impulse has to move from one cardiac muscle to another in order to penetrate the wall of the myocardium. This needs also about 0.03 seconds to reach the outermost point of the myocardium, so we need 0.06 seconds to cover the whole endocardium and the myocardium. Dromotropism is a term that refers to the speed of conductivity. We call substances positive dromotropic if they increase conductivity, and negative if they decrease conductivity. Regarding factors affecting conductivity, we have many factors. Most important of them are the nervous factor. Sympathetic logically causes increase in the conductivity because it decreases EV nodal delay. Parasympathetic does the opposite. It decreases conductivity because it increases the EV nodal delay. We reached the end of conductivity. See you again to complete cardiac properties.